Hi everyone, my name is Yi Rou. I am currently a PhD student at the Nanyang Technological University, Singapore, under the School of Medicine. So the topic that I'm going to present today is psoriasis, understanding the association between disease and gut microbiome. So here's an overview of the content that I'm going to present today. So I'll start off with some background information and followed by research questions, methodology, results, and lastly, conclusion. To start off with some background information on the topic that we did a scoping review on, psoriasis is a non-contagious chronic inflammatory skin condition with a complex etiology. It is usually characterized by thickened reddened skin appearing as a classic well-defined erythematous scaly plaque that is itchy and flaky, as shown in the picture here. So the prevalence of psoriasis ranges between 0.09% to 11.4%. And some studies find that the prevalence rate is actually affected by the geographical region of the patients. And so some regions such as Asians and African populations, they have lower prevalence rates as compared to population in Scandinavia and Caucasians, which have prevalence rates as high as 11%. The mean age of onset of psoriasis is usually below 40 years old, and a minority of them have a mean age of onset between 50 to 60 years of age. So how does psoriasis happen? There are certain risk factors such as family history, smoking, infections, and certain medications that can increase the risk of a person for developing psoriasis. And the underlying mechanism involves the T helper 17 cells that secrete interleukin 17A and interleukin 22, which are pro-inflammatory cytokines that cause hyperproliferation of keratinocytes, which is the cells on the skin, and inflammation of dermis and epidermis. So this will result in a classic appearance of a red scaly plaque that is shown in the previous picture. So taking that in mind, we are diving into one of the major topics that have garnered interest from many researchers over the past decade, which is the gut-skin axis. The gut-skin axis refers to a bidirectional relationship between gut microbiome and the skin health. So the association between the gut microbiome and inflammatory skin diseases is known to be mediated by dysfunctional intestinal barrier, increased inflammatory mediators, and also certain metabolites that is released by the microorganisms in the gut. Hence, this led us to our research question, which is, how does gut microbiome regulate skin health? And what is the current knowledge about the relationship between gut microbiome and psoriasis? So, in order to answer those questions, we conducted a literature review by scoping through several databases that include Ovid, Medline, and PubMed. The keywords that were used in our literature search include gut microbiome, psoriasis, probiotics, and other relevant synonyms were also included. Moving on to our results, this figure actually shows the composition of microbiome in patients with psoriasis as compared to healthy controls. So through our review, we actually found that the relative abundance of gut microbiome in psoriasis patients is significantly different from healthy controls. So as most studies were looking into mainly bacterial domain, so we only sum up the results for bacteria. Each circle here represents a phylum containing its family and genus in the circle. And we can see here the red colored words are those bacteria that were decreased in psoriasis, while the green ones were increased in psoriasis. And we can find that firmicutes were significantly higher as compared to bacterials. So this results in a high FB ratios, firmicute to bacterial, bacteroids ratio. And this FB ratio sounds very familiar because it is also associated in other comorbidities of psoriasis such as cardiovascular diseases and obesity. So here's another figure that can depict the specific species that are affected in psoriasis, which is shown here. So in psoriasis patients, they have higher abundance of E. coli, Doria, Ruminococcus, Collinsella, and Clostridium. While these four species, Akkermansia, Faecalibacterium, Parabacteroids, and Prevotella copri, were decreased in psoriasis. So a possible explanation for the pathophysiology of the changes in microbiome in psoriasis is that Akkermansia and Ruminococcus, they are mucin-degrading bacteria that produce short-chain fatty acid. And this short-chain fatty acid is important in maintaining the intestinal integrity. So in patients with psoriasis, they have reduced Akkermansia and Ruminococcus, which can in turn result in the impaired integrity of the intestinal barrier, which leads to local inflammation, systemic inflammation, and also the systemic modulation of the immunity. And moving on, we actually screen through all the research studies that look at modulation of gut microbiome using probiotics in psoriasis patients. So here are a few tables that summarize the evidence of microbiome modulation on skin health and also particularly on psoriasis. So this table actually adapted from the paper that we published recently on this review. And the first part of the paper showed that the effects of probiotics on general skin health. And we can see that it causes stronger skin barrier function and also reduce transepidermal water loss. So at the next section, we can see that this summarizes the effects of probiotics on psoriasis, but those are conducted in animal models, such as mostly in mice or cells. So similarly, it showed improved skin lesions and also reduction of T helper 70 associated pro-inflammatory cytokines, and also suppressed keratinocyte hyperproliferation in animal models. And this part of the table showed the use of probiotics in psoriasis in human studies. So similarly, the use of either bifidobacterium or lactobacillus probiotics result in a reduced plasma C-reactive protein and also tumor necrotic factor, which are pro-inflammatory cytokines that can produce in systemic inflammation. Other than the pro-inflammatory markers, the quality of life of the patients will also significantly improve, which is shown by the back suppression inventory and also the LQI. And also, the severity of psoriatic symptoms were also improved in these patients. So here's a figure that pretty much sums up everything that we did for the review. So first we look at the relationship between the gut and the skin. So we dive into how changes in gut microbiome, which is known as gut dysbiosis, can lead to intestinal barrier disruption and local inflammation, which in turn lead to systemic immunity modulation that can affect skin homeostasis by reducing skin moisture, impairing the skin barrier integrity, and also epidermal differentiation, which can lead to psoriasis through the mediation of all these pro-inflammatory cytokines that lastly lead to keratinocyte hyperproliferation that is shown in the picture here. And also we looked at how probiotics can help with improving skin health, and also specifically for psoriasis, how it is able to reduce the pro-inflammatory cytokines and the severity of psoriasis. So to conclude, Gut microbiome plays an important role in the pathogenesis of psoriasis, host homeostasis, allostasis, and its association with distant organs beyond the gastrointestinal tract. And our review also showed that there is a difference in composition of gut microbiome in psoriatic patients when compared to healthy individuals. Lastly, the modulation of gut microbiome using probiotics, specifically Lactobacillus and Bifidobacterium in psoriasis, showed an improvement in biological markers and clinical symptoms. So with that, I would like to thank all of you for listening. And here are some references that I used for this presentation. And I would like to thank all the other co-authors for our paper, which are the team under Dr. Lee, Dr. Teng Hen, Dr. Benga, Dr. Jody, and also thank you, Angel, and also other collaborators for this paper, which include Dr. He, Dr. Sunny, Dr. Chan Kok Gan, and Dr. Siva. Thank you, everyone.